like to thank you all for attending our first ZagTalk webinar of the summer. My name is Jim Fawcett. I am the Assistant Director for Marketing and Education in New Student and Family Programs. Today, we have for you a few of our content experts on campus in regard to health and well-being from a few different offices. And we're going to start today with our Director of the Office of Health. I'm sorry, mic cut out for a second there. We're starting today with our Director of the Office of Health Promotion, and her name is Jenna Parisi, and she's going to do a presentation for us.
Thanks, Jim. Hello, everyone. It's very good to be here. I'm going to go ahead and share my screen in just a moment, but I wanted to just briefly introduce myself. So like Jim said, my name is Jenna. I have been at Gonzaga as a staff member for 7 years now. I also graduated from Gonzaga. So my parents were in the same position as many of you, wanting to know what are we getting our child, our student into, what resources are going to be available to them. I have my bachelor's degree in sociology and women's and gender studies, again, from Gonzaga. And then I have my master's degree in public health with a concentration in health education and health communication from the Johns Hopkins Bloomberg School of Public Health. And it was a pleasure to come back to join this community and try to be of service with the skills that I bring to the role. So let me go ahead and share my screen, and I'll talk a little bit about how the Office of Health Promotion helps to foster student well-being here on campus. And like Jim said, you'll hear from some other colleagues, so feel free to put questions into the chat. Once I'm done, I will help field those, and if there are ones that are not appropriate for me, I may know the answer, but it may also be more or less someone else's job, so I'll make sure that you get to the right place. All right, Jim, are my slides showing okay?
Yes, it looks good.
Great, I will proceed. So welcome again. This is the Office of Health Promotion, and really our focus is to foster, and I'm not able to advance my slide. Here we go. Foster student well-being through proactive, non-judgmental, and inclusive public health principles and strategies. And I imagine that most of you, because of the COVID-19 pandemic, when I say public health, have a little bit of a sense of what I'm talking about. And so that has really been a way that we've been able to kind of expand our approach on campus. Our goal is to help make it easier instead of harder for students to be well while they're here with us at Gonzaga. And ideally, we want all students to have plenty of opportunities to learn, to reflect, and then to act, and put in practices that are going to help them cultivate lifelong well-being. So you'll see on this slide, if you're able to access those, I'm happy to send them after as well. ZAGS Help ZAGS is the name of our bystander intervention program that we run on campus. And you heard me use the word public health approach. And again, to us, this means that we come to this work with an understanding that students do not make decisions in a vacuum, right? There's a whole layer of things that influence the decisions that they make on campus. So individually, your children have lots of different skills, experiences, attitudes, identity that they bring to the table. And at the interpersonal level, there are folks like you who are really significant and influential in their lives. So you help teach them things, you send them messages, whether implicitly or explicitly, that may condone or support certain behaviors. And so that's why you all are a really critical group, and believe it or not, continue to be incredibly influential in the lives of our students. So we really enjoy working with you all as partners, and very much see you as aligned with our approach. We know that at the institutional level, Gonzaga also has some responsibilities, and we have norms, and we have a culture here that, again, we're trying to enhance, that makes it easier for our students to take care of themselves and to take care of each other. So my department historically has focused on 3 topic areas, and then we bring the lens of health equity. So we're trying to focus on who is most affected by this, who is differently affected by these topics, who do we need to be paying attention to, and what resources can we create or support or promote to help enhance their health and well-being in that realm. So the first one of those has to do with healthy relationships, sexual health being part of that, and our violence prevention work. The second arm is substance use, partying, everything that goes along with that. And I'll speak a little bit about our collegiate recovery community that we have on campus. And then the third arm is mental and emotional well-being and suicide prevention. And I imagine many of you have an awareness that mental health has certainly been a tremendous need among our students. It's nothing new to us on campus, but we know that COVID-19 has certainly exacerbated that in some particular ways. Oh, let me go forward. There we go. We also use the 8 dimensions of wellness. So this is a framework that helps us communicate with students in a way that acknowledges, aligned with our Jesuit mission, that well-being is supposed to be holistic and it's multidimensional and multifaceted. So we use these 8 wheels to talk with a student about maybe goal setting, maybe being in balance. It's not realistic that they're going to be 100% at all times. You can be really helpful in acknowledging and reminding students that stressors are an inevitable part of the college experience. They're inevitable in life, but particularly in this environment as well. So what do they need to do to kind of enhance their well-being when it starts to slip in one of these areas? And maybe what are they already really good at? What habits do they have in place from high school that they want to try to carry over into this environment with them? Oh, keep going back. So what does the Office of Health Promotion do to help promote student well-being in the topics that I just introduced to you? Well, we tend to do a lot of assessments. So we're one of the entities that gathers data from students. We ask them what's going on in your lives, what's changed, what do you need, what do you want from us? And that really informs the type of materials and programs that we create. So health communication has to do with messages that we put out in the environment. So that might be something like a flyer in the bathroom stall that a student in a residence hall might see. It might be digital signage that a faculty member could use in a classroom when a student goes in so that they know, hey, this is a topic that we can talk about. My team does a variety of presentations, trainings, workshops, so there are opportunities for students to engage with their peers and talk about these topics and things that are going on in their lives. We have educational conversations with students, particularly for those students who may end up in our office because they're mandated to do so. What we know is that because of the approach we take in those conversations, they ended up being really pivotal and positive experiences, again, with staff who have the values of non-judgment. We want to include you. We want to help you make decisions that are supportive of your values and your goals in your life. And then I think online tools and resources are really helpful to mention. While we are in person, there are still things that we want students to access whenever it's convenient for them. We know a lot of students are on their phones, so we put a lot of effort into social media, into online tools and screening and things that they can access when it's convenient for them to do so. All right, so I would be remiss if I gave you the impression that I do all this work by myself. I definitely do not. So I have the pleasure of just kind of overseeing this area. We currently have 3 professional master's level staff who focus on each of those priority areas. And then we work with a whole cadre of fabulous student employees that we train, including graduates and undergraduates. So this is in flux because we've had some folks graduate and move on, and we'll be rehiring. So I also wanted to mention that in case you have a student who has a passion for some of these areas. If they've been a peer educator, if they've been in the club, if they've been impacted by one of these issues, if they just want to get some experience in an office, we will be recruiting and looking for that, whether that's in their first year or the tenure of their time here with us at Gonzaga. And there's lots of different areas of focus in those positions, including education, outreach, and identity-specific roles. Oh, there we go. So here's just an illustration of some examples of other things that we do and students who have worked with us. So in the bottom right-hand corner is what's called a health hut. It's missing this giant awning that goes over the top, but that's one of the outreach vehicles that we have students do tabling, trying to engage each other and their peers around topics. In the upper left corner, you see an example of an awareness event that was happening. So the clothesline display to draw attention to the issue of violence, who's impacted, each of those shirts colors meant a different thing. So it may be things that folks see in the environment as they're passing through. Again, the lower left was some of our student employees from last year having a grand old time. They put together a new series of TikTok videos. So it's always a good laugh trying to engage folks around these topics. And then I put the facts and myths because, again, for a lot of these topics, what we're doing is sometimes remedial education and sometimes really a deepening and a furthering, again, of What do you know? What are your values? What are your goals? How can we help deepen that knowledge and help you differentiate from maybe what you've heard or what you've learned with some resources that we vetted and feel like are good places to get your information from. All right, here's an example of a health communication campaign that we ran the past few years. I had a student marketing assistant who came up with this Spiky the Bear routine. So just know, again, we're always a turn to kind of what are the trends on campus? What are the behaviors that we're seeing? What are the ones that we really want to enhance? And then we try to get these flyers and messages up all over the place. So you will often see materials like this, through new student family programs. All of my staff and our student staff write articles in the family newsletter. And so those are often about these topics, giving you kind of tips, tricks, and letting you know what's going on campus, what's upcoming, how your student could continue to engage with us and with these topics as they go through their college experience. Hopefully, we don't have to focus on this as much in the upcoming year, but know that 2 of my staff have also been part of the contract tracing team. So it's really been forefront of our attention in how do we enhance the college experience, but continue to mitigate any risk associated with it. All right. I mentioned that we have a collegiate recovery program. So this is an example of marketing material because we have a lot of students who come to Gonzaga who may already identify as being in recovery, that may be from a substance use disorder or maybe from something else. We have students who maybe have identified as in recovery from an eating disorder or from a mental illness or from a pornography addiction, or maybe they're just thinking about getting sober, or they're thinking, I want to cut back on my marijuana use, or I want to stop my e-cig use. And so this is a program that's there for them. It is a house on campus that's non-residential. It's just a safe, beautiful, fun place for students to gather. We have been the recipient of a grant for the past 3 years, and so it's really a growing, exciting, flourishing community. Students can be referred by a staff member on campus. They can reach out on their own. They can come for drop-in hours if they just want to learn more. Oftentimes a student will say, I have a concern about my roommate, or maybe I have a concern about somebody in an organization or somebody in a class, or I just want to learn more, or maybe this is part of my experience in my family, and I also want to connect with other people who kind of understand that. So we are one of, now over 100 programs across the country that offer this kind of program, but again, really excited, think it aligns with our mission. And if you're interested, if this is something that your student might be looking for, please reach out to this recovery@gonzaga.edu email. My staff member will get back to you as soon as possible and can offer, early introduction, tours to the house. Students who are members will have 24/7 access with their student ID card. So we're happy to start that off right away for them. All right, the Wellness Toolbox is one of the online resources that I mentioned. So it's just a passive health education vehicle. A student can go in. Any of you can check this out ahead of time if you'd like. And there's a number of topics on there that we know students are, likely to encounter in this environment. We talk to them a lot about, regardless of the choices you're making. So even if you're not experiencing microaggressions every day, or you're not drinking, or you're not having sex, or you don't have a mental illness, it's highly likely that you will encounter another peer or someone in this environment who does. So we want them to be able to learn more. There's apps, there's resources, there's information on here that, again, they can do and access at their convenience. And we're always trying to add new things to it. Mindfulness is a great technique that works for a lot of folks to try to, again, cope with the stressors of college and other things that may be going on in their experience. So if you have a student that enjoys that or wants to learn more about it, it is a monthly guided meditation that we offer in what's called the reflection room in one of our main student buildings on campus. So that's another thing that they can be on the lookout for. And then there's a way for students to get engaged or to request programs. So we have faculty and staff that do this. They might say, hey, I've noticed this in my class. Can you come in and talk about it? Or we have a unit on a certain book chapter, and this seems really aligned. So they may see us interacting with them that way. It may be somebody in a residence hall who says, hey, I noticed that students in my hall are really excited about this topic and they want to learn more. Can you send a student employee in? Or if a student individually is looking for something, we may be able to connect them with student clubs or other vehicles who share that interest or that lived experience. Active Minds is one of those clubs that's really focused on student mental health. So again, if you have a student that knows that that's part of something that they're interested in, that might be something that they look for sooner rather than later. Okay, and I'm going to put this slide up that has contact information. You are welcome to follow us on social media, check out the website, reach out if you have questions. That ohp@gonzaga.edu email is the easiest place to do that. But let me pause and Jim, maybe see what questions are out there right now.
Yeah, we'll leave that slide up for a moment if anybody needs to copy down some of that contact information. Haven't had any questions come in quite yet, but did want to mention that there is some really great information from the staff in the Office of Health Promotion in our newsletter and our online Gonzaga Parent and Family Portal. It's some of the best written content on there and is some of the most read content on there. So if you want to peruse through there, there's some great advice about starting conversations with your students and some great advice about just some of the culture on campus here. So they do amazing work and we're very, very proud of having that resource on campus for them. But as Jenna mentioned, if you do have questions, you can add them into the chat and we will address those. But for now, we are going to move to Christiana Holmes. She is the Director of Health and Counseling Services here at Gonzaga. She's going to talk to you a little bit about what they do.
All right, hi, can you hear me okay? Okay, perfect. I am actually going to share my screen. I'm going to pull up some slides here as well, though I did notice that Jenna's slides are way nicer than my slides. She has way pretty pictures and colors. But anyway, let me see if I can pull these up here. And I will start sharing my screen. And see if I can go into, all right, can everybody see that? Okay. So I will introduce myself as well. I'm Dr. Christiana Holmes. As Jim was mentioning, I'm the Director for Health and Counseling Services at Gonzaga University. And my background is in healthcare. I, many moons ago, worked as a nurse practitioner and over time have worked in education and administration and have had a wonderful time at Health and Counseling Services here at Gonzaga. So I would love to share a little bit about who we are and what we bring to students on our campus. And basically just letting folks know that we're a clinic on campus. We offer holistic, comprehensive healthcare, but we do this in partnership with our students. So our students are our customers and they are the ones in charge of their own health. And some of our students, when they are first coming to us, they don't really know or understand that they get to be in charge. And so we try and advocate and work with those students to help them kind of know and understand what healthcare is and how they can be managing their own healthcare. And it starts right here on our campus, which is lovely. We do keep students, or we try to keep students moving toward their educational goals and really maintain their focus on the well-being of the whole person. So, you know, to be healthy physically, mentally, spiritually, and in many different ways, it's all part of this process. And if we can help them and walk alongside them in this journey, that's how they continue moving toward those goals. And that's the reason why they're here, why they're at Gonzaga University. Some of the essentials for health and counseling services, just for your information, is that we are campus-based and we are for campus-based students. So we serve undergraduate students, graduate students, we serve students from the law school. We partner and collaborate with the University of Washington School of Medicine students. And so we have a whole host of folks who come through our doors. And our providers here, including our health services providers and our counseling services, see these groups of students. Virtual students, those in a solely online program, don't participate in receiving our services. So it's campus-based programs. As mentioned, we do function as a clinic and a behavioral health clinic. We are integrated. And basically what that means is that our mental health services and our healthcare services operate in the same department, and we have crossover functions, and we serve students collaboratively. So we may have a student who comes to us through health services and maybe is struggling with depression, and we help to connect them with our providers in mental health care, and vice versa. And so it's one of the things that I feel is such a significant aspect of the care that we provide, is that we are an integrated service. And so it makes a difference in how we look at students' health and what they need while they're here at Gonzaga. And so I'm really proud that Gonzaga has embraced that model and that we can provide care in that platform. Our services are here Monday through Friday. We're open from 8 to 4:30 p.m. Thursdays we're open a little bit later because we use some time for staff time for us to connect as a department, and also to kind of learn and grow as healthcare professionals and mental health care professionals. We operate on appointment-based. We are an appointment-based, I should say, clinic. And so basically a student to meet with one of our providers or counselors calls, schedules an appointment time, we get them on the books, and they come just like you would at your clinic in your hometown. We do have triage that is available. Our nursing staff, our RN staff run triage. So if we have a student who comes in with a concern or an issue and they don't have an appointment, our nursing staff is able to connect with them and determine what level of care they might need. Is it immediate care they need? Is it something that we can schedule an appointment for? And so on. So that also is a way for students who may have a need, but it's not an urgent need, to speak with our nurses and get some education on maybe what they can do for self-care in the interim, if they are waiting for an appointment, or if they don't even need an appointment. So it's just this wonderful service. And the RN staff that we have, these folks come to us from a variety of backgrounds, and they are so good and so expert at what they do. And our students just love them. They get them feeling better. Sometimes we see students, they're pretty young. This is their first experience with healthcare or mental health care. And they just kind of need that bridge from my parents used to do this for me, or my guardian used to do this for me, to now I have to try and do this on my own. So our staff is very caring and empathetic, and can really provide that that feel for the student that they aren't alone in this. And I think that's very, it's well received, and students appreciate that. We are located right here on campus. We are just steps away from the residence halls and from the classrooms. And I think that is such a benefit for our students, that they can access care without having to go kind of outside of the four walls of Gonzaga, the campus. And I've just put this little map on here so you can kind of see where we're located on the, I guess it's the northeast corner of campus, right off of Sharp Avenue. So the folks that we have on staff here at Health and Counseling Services, we have, for health services, we have providers including a family physician, advanced practice registered nurse. We have registered nurses, and we have medical assistant, and those are our healthcare service clinical staff. For the whole department, we have administrative staff who function in reception roles as office assistants, and they really are kind of always functioning in the background, keeping us moving forward. And without them, our practice would come to a standstill. So we so appreciate what they do, and the fact that they get students in through the door so that they can receive the care that they need. Our counseling services, we have a psychologist on our staff. We also have multiple counselors. We also work with a residency program, and we have interns, counseling interns who come and practice here as well. And that is a wonderful construct because we have collaborations and partnerships within our counseling services that help our professional staff, our residents, and our interns to continue learning and growing and providing real high quality care for our students with their mental health services. We also have psychiatric services, and we have a psychiatric mental health nurse practitioner who sees students on a regular basis. We also have residents who serve in this capacity as well. And so we have a pretty well-rounded group for our department as a whole, both physical health and mental health aspects. And these folks, just maybe to kind of share with you, these folks, for the most part, have been serving in a college health setting for quite a number of years. Some folks are a little bit newer, but many have been here for a period of time. And they really are experts in the field of college health, which is in and of itself a niche or a niche in healthcare and mental health care services. And having that expertise in college health is significant because we know when our students come through the door that we have many layers within our institution, like Jenna's office, like Sean Joy's office, who I believe will be talking to you shortly, and many of our other disability services, all sorts of things across campus that we can directly connect with to kind of provide that web of support for students. And so we have these folks who are experts in college health and know how to help our students navigate even beyond our walls. This is a really busy slide, and I'm not going to read all through it, but we do provide a pretty comprehensive list of services. We do provide care for COVID-19 for screening and testing, but also just acute and chronic illnesses, minor injuries, and lots of other things. We do have lab accessibility, X-ray accessibility. We do provide options for transportation if a student doesn't have their own vehicle or doesn't have a car that maybe their roommate can give them a ride. So we do have options for transportation. For counseling services, it's kind of some of those really core mental health areas that we see in students, especially at this stage in their development. And these, like anxiety and depression, you folks may already know this, but there are high percentages of students who deal with issues related to anxiety and depression. But we see students for things like being homesick or being lonely, relationship stressors, suicidality, stress management. And our psychiatric services are there to, if need be, provide consultation for, is this a circumstance where a student may need additional layers of support for their mental health issue, including things like medication management. So again, pretty comprehensive. There may be a time or two where we have to refer students out, and I'll talk about that a little bit down the road here. I did want to just share with folks that our counseling model is considered a short-term model. It's solution-focused, and students and counselor and their counselor, when they meet, they basically establish an action plan, and they look at, okay, we're going to have this many sessions to try and reach our goals, and those goals are determined together with their counselor. And this is a really successful model in college health settings, and it's done in many institutions across the nation. And Gonzaga Health and Counseling Services subscribes to this model, and it works very well. There are times where we may see a student who has maybe longer term mental health care needs, or maybe the complexity of them requires some specialization. And so we work with students to find referrals out in the community for those who may need longer term care. And oftentimes we're partnering again with folks in the Center for Cure Personalis and maybe some other areas if we do have students with needs that might stretch beyond the short-term or solution-focused model. As far as costs are concerned, counseling services are at no cost. And I say that, but there's something called a wellness fee that students are accountable for in their tuition and fees. And so that's how we're able to provide counseling services at no cost. So they can come in because they've paid their tuition and fees and they get to see counselors, and there's no charge for that service. Health services is a little bit different. There are some low cost aspects to this. Students may need some sort of medical device, or they may need a medication, or they may have a more extensive visit, and there may be a charge for those services. But usually that is, for the most part, is less than or comparable to what a copay might look like for you or I going into our clinic. One thing of note is that we don't do any direct insurance billing. If there is something that a student would like to submit to their insurance company, we do help with documentation, claims forms. We can provide those to the student, and if they have questions about how they submit this, we can go through that information with them. Usually speaking, payment is due at time of service, and students have a variety of ways they could pay for any health services that they have participated in. They can put it on their student account. They can do Bulldog Bucks. They can do debit credit card. So it's pretty flexible. And our triage visits with our registered nurses are at no cost. There are times when students, believe it or not, may have issues that occur after 4:30. And so we want to be sure that they also have access to care in the community. So we do have resources on our website. We have resources lists that we have here at Health and Counseling Services in our building. And we want students to be able to access clearly the emergency room or urgent cares or things that they may need outside of regular health and counseling service hours. So we do provide access to those resources. We partner with the behavioral health and healthcare facilities throughout Spokane. And one of the nice things I think is that we have those relationships, but I think we're continuing to grow in how we foster those relationships and really have better connections with those facilities and the folks who are at those facilities, so that when the time comes, we're talking to people who we've maybe worked with before and understand what a Gonzaga student might be experiencing. And I would say that our Center for Cure Personalis is really key in that partnership with external agencies as well. And my guess is that Sean will talk a little bit about that too. But we do have access to care outside of our regular working hours. One thing that I think is maybe of interest, I don't know, it's just is what it is that we as a clinic and a healthcare entity have to abide by federal laws that are related to privacy and how we manage healthcare information. And because we work at an institution of higher education, we follow something at Health and Counseling Services called the Family Educational Rights and Privacy Act. It's FERPA. And this, most people outside of education know something called Hipaa. It's the Health Insurance Portability and Accountability Act. And these two things are very similar, but FERPA is very, very, very specific to educational institutions like Gonzaga University. And so we have to abide by all of the laws that are related to FERPA as a clinic. And so that just means that our students have the right to privacy, that we don't get to share their information. And this sometimes rocks the socks off of parents, that if you call and your student is 18 or older and you say, hey, I'm wondering if Susie came in today and how she's doing, we will have to say to you, I am so sorry, but you may have to connect with your student to get that information, because we aren't able to provide that because of these federal laws. And so we talk about that at times with parents for sure, and oftentimes with students as well, so that everybody kind of knows and understands, what does that mean? You know, if there are cases where a student is at high risk for things like self-harm, the FERPA allows us to be speaking with other folks, because we know that there's something that could be very concerning happening. But that's really clearly a rare exception, and one of the only exceptions. We also follow Hipaa rules, but that is when we're working with an external agency, so maybe a hospital or another clinic in town. We have to abide by Hipaa when we engage with those external agencies. But these laws are there for the protection of patients, and they're important. They're important for all of us, and they're certainly important for our students. My guess is that folks still may have some questions about COVID-19 and what's going to happen this coming year and so forth. And I can speak for Health and Counseling Services. When students enter our space, they will still be required to mask, even though on campus masks are optional at this time. We do provide COVID-19 visits. We have lots and lots of students coming in with symptoms that are similar to COVID-19. And so we can see them and determine, is that what you're dealing with, or is it something else? And then provide them any information they might need related to, how do you manage COVID? What do you need to do? We will also, my understanding is we will also still continue to have some contact tracing available, or COVID coordination available for the institution that will help support students if they do have COVID issues coming up in the fall. We have counseling support for students who may have been impacted by COVID-19, or maybe have had family members that have been impacted. We do have COVID testing here on site. We can provide vaccination support. We don't provide the vaccine, but we have many, many local agencies very close by that do provide the vaccine. And our goal is really to keep our students and our staff safe. And so we look at environmental aspects within our building, and we use personal protective equipment with each of those visits. And that is, I think, all that I have to share. It is kind of a general rundown of what we do here at Health and Counseling Services. And we just are so privileged to engage with students in their healthcare, especially because it is often, when they step into Gonzaga University, is often their first time where they're trying to manage that themselves. And so we want to walk alongside them. And really, by the time they exit the university, they know the drill, and they know how to do a lot of self-care. They know how to navigate our system here, and maybe even outside of health and counseling. And so it's a journey, and we're just, again, so privileged to walk alongside students as they become owners of their own health. So here's our contact information. And if you ever have any questions, please feel free to reach out and call. And I can certainly take questions now or at the end of the conversation. And I will turn it back over to Jim.
All right, thank you very much, Christiana. That was a great overview of the resources and services that HCS has to offer. I do want to move on to our last presenter. So Christiana, if you can look in the chat, I think starting in about 1:29 p.m. in there, you answered a lot of questions that people had as you went along, but there are some from 1:29 p.m. moving forward that you can probably address. So thank you so much for that. And if we have some time at the end also, if you want to address anything further, that'd be fine. So Our next presenter, Sean Joy, is the director for the Center for Cura Personalis. I'm going to let him tell you what Cura Personalis is, but they are a great resource for campus, and they kind of like bring everybody together. So without further ado, Sean Joy.
Thank you, Jim. Can everyone, excuse me, can everyone hear me okay? Perfect. Allergies are a real thing right now here. A lot of colleagues are getting out inhalers, and I'm sure some of you are experiencing that as well. But let me share my screen here with you all. Alrighty, so the Center for Cura Personalis, or CCP for short. There we go. No. Okay, so Center for Cura Personalis, in our, this of course not working. 1 second, there we go. So Center for Cura Personalis, so what is Cura Personalis? So it's a big part of our Jesuit framework here at Gonzaga. Cura Personalis loosely translates in Latin to care for the whole person. So we're looking at all of our students and all the unique pieces of who they are, all of their identities, all of their thoughts and values and beliefs and things that they bring as a whole person. And our goal is to support that in a fashion of resource brokering, which I will get to in a second. But we're focused on, as Jenna had talked about earlier, the 8 dimensions of well-being, focused on supporting students in their journeys holistically. So what do we provide? So we are non-clinical, so we're not counselors or therapists. We are case managers. So we do have a social work foundation. So our goal is to work as I said earlier, resource brokers. So we connect students to resources both on and off campus, supporting them in accessing those resources, supporting our colleagues on campus with referrals, how to support students in moments of crisis, in moments of concern, and supporting you all too in your journey. We speak to a lot of parents and families about their student or concerns they have, and we help walk alongside you as well in that journey and how to get them connected, how to motivate them to connect to resources. Our number one goal is to help students be self-advocates, right? If I'm struggling, if I'm having a hard time, what are the tools and pieces that I can use to access those resources? And as Christiana said, right, we want our students when they leave Gonzaga to be able to access, all kinds of resources and services. And so we work really hard with our students to process that with them. We also provide some training and consultation to our colleagues on campus, faculty and staff, as well as our main process of receiving concerns are through our refer form, which I will talk about in a moment. So in a nutshell, why is this important, right? I remember when I was planning to go to college back over 10 years ago, and I remember, I had my whole plan set out. I was ready to go. There were no concerns in my way. I knew my mom would cry every day, and she still does. I'm almost 31 years old. And so I thought I had this trajectory. And the reality is lots of things, lots of barriers and different things that I did not plan for occurred. And this happens for most, if not all of our students at some point in their journey. And these things that weren't planned for. And so our function as an office is to help students through those and help them become advocates to help them figure out how to get through some of those pieces later on too in their journeys here at Gonzaga. So briefly, our case management model, our main purpose is to support and create a hub of outreach for our students. And we'd like to say that we are a central point of contact for any concerns related to students. Also for students, if they don't know where to start or they need support, they don't know where to go, we always like to point them our direction, and we can find those resources or those people or those things that they're looking to connect with. We also help lead some of the efforts on campus related to mental health crisis and emergencies. And so my team, we are on call during the fall and spring academic semesters, and we support students who are experiencing mental health crises or maybe being hospitalized for mental health emergencies. And we support the student as well as the support units through those processes and making sure they get the care that they need. We also work, as Christiana mentioned, with agencies in Spokane and across the nation really as well in helping to increase access and equitable access for our students to certain resources. And recently we added a basic needs program. So this past year we supported over 30 students in accessing things like meal swipes, emergency aid, right? Parents lost jobs due to COVID, needing, gas money to be able to get home to a funeral, those types of things, and really trying to increase that collaboration, that holistic support we provide for our students as well. So what can we help with? We can help with anything. We're like, think of us like Mary Poppins is bag, plural for Mary Poppins, well, singular, but we can help with anything. So from mental health concerns to any physical injury, sexual and physical assaults, concerns with roommates, how to navigate those pieces, questions about different processes on campus, academic pieces. We can, any issue or concern, we can help students navigate those pieces and find the right connections for them. And again, we work with all of our campus partners in really trying to increase also their understanding of what we do and how we support students, as well as the ease of connection for our students and helping them to figure out a solution to their concerns, figure out how to become a self-advocate, as well as to make sure that these resources are functioning and working for them in an equitable way. So again, the biggest thing I want to say here is we're a great place to start for students. So I encourage for you to start talking to your ZAGs and talking about our office, and that, can meet us at the beginning of the year and stop by our office and say hello. And we can talk before then as well and establish that connection. And what I would like to say too is that, and this statistic is definitely changing, but over a third of our students that we meet with are self-referred. And the more that our students hear about our services, the more they are self-referring and coming by or submitting a refer form about themselves. And so we love that. And that's to my other colleagues on this call, and to that's to their success as well. And to Jenna and her team for advocating for that, to normalize mental health care and support in our community. A couple quick things that we are misconceptions. So again, we are not counselors. We are not a part of conduct or a resolution center for student conduct and conflict. However, we do work very closely with them in supporting students in those processes and in their conduct outcomes. Meetings are not mandatory. None of our students that we meet with or that get referred to our office, we do not make our meetings mandatory for them. And we can't excuse students from classes. However, we can help students in the communication with faculty, with some of our academic partners. If there's an emergency or a funeral, or if the student is ill, we can work with them with some of the language and some of the ways that they can advocate for themselves with their faculty members. So referring, so there is not a bad way to refer to our office. So you can call us, email us. Also, the main way, as I said earlier, is our refer form, which is a joint partnership with the Office of Academic Advising and Assistance. So that form is run through a university database. It comes directly to myself, and then I parse it out to my team. Each case will come in, and then I will pick a team, one of my team members, and they will reach out to the ZAG and check in with them and usually say, hey, I heard you might be struggling. This is what I do here. I'd love to meet with you and we can chat about ways to get you connected. And also we have a lot of students and folks and families that walk in, and orientation will be around as well. And so we are here in Crosby 216 in the middle of campus. Again, refer forms come in, I assign them out, and then my staff reaches out to our students. We'll skip over that. So we have some great 24/7 resources. Jenna touched on this, Christiana, but these are also numbers and things that our students have. Some of these numbers are on the back of their IDs. They're placed in a lot of places, and these are resources we use quite frequently. So I know I sort of flew through that, and some of that might be my allergies talking, the pollen. But again, if you have questions, if you're intrigued by how to support your ZAG, how to accompany them on their journey, you're preparing for those conversations, please, please, please reach out to us. Happy to chat, happy to connect, happy to share stories about how my mom is still sad that I live halfway across the country. So would love to chat more, and I appreciate everyone being here today.
Thank you very much, Sean. We appreciate that overview of CCP. I do see that Christiana is working through the questions in the chat and trying to get back to everybody. Christiana, I'm not sure if there's any questions that you wanted to address verbally for everybody.
It might be faster.
Yeah.
So are you okay with me doing that, or is this a good time?
Yeah, we've got 9 minutes to kind of handle some questions now.
Sure. I think I just had a few left here. So the question that I'm on right now is the question that says, on parent forums, I've seen concerns raised that the health center is sometimes closed or does not answer the phone during regular hours. Has this been a COVID or staffing issue? What plans are in place to prevent this from being an ongoing problem? Thank you. So this is an interesting question because we are fully staffed from 8 to 4:30 Monday through Friday, with that exception being that small time frame on Thursdays. And what I would say is that there may be times where the phone isn't answered directly if somebody's on with another student, but we literally, as we have had heard concerns coming in, we literally have done monitoring of our calls and our response time to calls. And the reality is that basically we return calls within 24 hours max. And so when there is a circumstance where maybe a student hasn't heard back, it's possible that we didn't get a phone number, and these are legit, like they didn't leave their phone number. Sometimes students don't leave even their names. They just say, hey, this is what's happening. And so I don't say that as like, here's the excuses, but what I'm saying is that when we heard those concerns, we actually did monitoring and we were documenting, and we went for months where we were tracking this. And what we found is that there wasn't a pattern of not getting back to students. I think sometimes, folks, and I do this too, if I have a need or a concern, I'm hoping somebody's going to get back to me immediately. And so when that doesn't happen, sometimes it just raises a concern. So I hope that's an adequate response. It is definitely not the norm. I do think that when we don't see what's on the parent forums, we can't respond to those questions or concerns always. And so sometimes there's information that we don't get to share in response. So I appreciate that question because, that would be concerning for a parent coming in if this is what they're hearing. But we did our best to kind of say, hey, is this a real issue? Is this a real concern? From the few things that had floated through. And what we found is that we were pretty darn good at getting back or attempting to get back to students in a very timely manner. So thank you for that question. The next one is, what if the student has given authorization to a parent for health information through Hipaa release? Absolutely, that's a great question, and thank you for bringing that up. If a student has an issue and the parent, would like to be involved, that conversation happens with the student and the parent. And that student can then sign a release of information and say, I want my parent or guardian to be able to share and have an exchange of my personal health information. So they definitely can sign a release of information. And we have lots of students who do that. We have some who, they protect their privacy and they're like, no, I don't need my parent to be involved. But we have lots of students who sign a release and say, yeah, I need my parent or guardian to be a part of this process. Our COVID-19 visits also billed, testing available at no cost or available at all. So this is a little bit of a transition. So this whole 2.5 years, whatever it's been, we did not bill for testing and things like that. The exception would be if there was something called a PCR test that that we had to run through an outside laboratory. That laboratory may have either billed insurance or had a fee, but generally speaking, there really hasn't been anything charged related to COVID-19 in aspects of testing, contact tracing, things like that. This coming year, we are moving from pandemic to endemic structure. And what I mean by that is we are trying to now treat COVID-19 like any other illness that would walk through our door, because it really is now. So somebody could walk in with the flu or with strep throat or with an injury, what have you. And we're trying to treat COVID-19 now more like this is what we're going to be seeing on an ongoing basis. COVID won't go away. So we need to, act accordingly. So if a student comes in for a visit and they think they have COVID and we test them for COVID, for testing purposes, there may be, again, a nominal charge for that. And for COVID visits, there probably would be a charge for a visit. And what we're trying to do is create a structure where if we do have to do some testing, we're not billing for each individual item, we're kind of billing as a whole of a visit. So we're working on that piece because that's a transition for us. If we would have circumstances where I'm going to just play like worst case scenario, we had a huge outbreak on campus. We had to, because now there's this new variant that's just crazy like Omicron, and we had to do mass testing. Historically, there has not been a charge for that. And we've run, thousands upon thousands of tests. And so, if that were to happen, my guess is, and I don't speak for the institution, but my guess is we would probably not be charging students if we had to do mass testing. So that would be my educated guess if that was a circumstance that would come about. Let's hope it does not. And the question is, I think I missed one. What is a low cost amount? So the costs can vary and it depends on the type of visit, but they're as low as $15 and I think maybe as high as $40 for a visit, and it depends on the comprehensive nature of the visit. So if it's detailed and we're doing lots of different things, there may be a higher charge. But generally speaking, we try and keep it low cost because we know that students are, they have a lot of expenses, and we're trying to make it so that cost isn't a barrier to their health care. If there have been times when we have had students that maybe cost is an issue, and we do try and connect with those students and see what we can do to support them and so on and so forth. And sometimes we're working with different offices to do that. Jim, I think
you got through all of them. There was just one last one about can an allergist provide shots to be given at Gonzaga?
And I did respond to that. And we
Yeah.
do not provide allergy shots here, but we can connect students to an allergist or an allergy clinic in Spokane. If there's a wait time between when we see them and when they can get to an allergist, we may be able to support some of their needs. We probably wouldn't be able to provide their allergy shot, but we could do other things until they get in with that specialist. And I did see there was one from a particular person that I might respond to just individually as well.
Okay.
So,
Great.
yeah.
I think that is most everything. Thank you so much for taking the time to answer those questions. And thank you to Jenna Parisi and Sean Joy as well for their presentations today. Everyone's contact email is very simple. The Office of Health Promotion is ohp@gonzaga.edu. Center for Cure Personalis is ccp@gonzaga.edu, and Health and Counseling Center is studenthealth@gonzaga.edu. So very easy to get a hold of them, ask further questions if you have any, but please encourage your students to take advantage of these resources. These are very professional, very dedicated resource providers that care very much for your student and their success. So please encourage them to do so. This webinar will be is being recorded and will be posted on our parent and family portal, along with all of the answers that are in the chat today. And we do have 2 more webinars coming up, one in July around diversity, equity, and inclusion, and one in August around student involvement, and we will have a student panel available at that one to answer questions. And information about those will be going out through our portal and on social media at Gonzaga Families. So I think that wraps it up for us today. Thank you so much to everyone for your participation and for being here with us. And have a great afternoon.